Hey everybody, Mike the PT here. Welcome to the clinic. What do you guys think? Outdoors, backyard, sport court, and treatment table. It's about all I need, right? Hey, welcome back to the channel. Appreciate you being here. I'm having fun creating some content and I hope it's valuable to you. So on Instagram, had one of my good friends reach out to me and say, hey, talk about my arch nemesis, shin splints, okay? I have treated him before and he is experiencing a new type of lower extremity pain. And this one is definitely what we would consider an overuse injury. It's not something that happens acutely, right? You're not getting hit by a car, you're not being ran over, you're not twisting your ankle, and you're not falling on the dirt. This is gonna be pain that develops around your shins. There's two sides to a shin bone, so there's two different types of shin splints that you can get. I'm going to talk about that. I'm going to talk about identifying it, and pretty much you know what it is just the minute you feel it, right? We know what we're getting into when we start to have what we call shin splints. So we'll talk about the two different types of shin splints, and then some treatment methods, like from my standpoint, from what a physical therapist can potentially do for the shin splints. And then I'll show you some general exercises that you can start doing to help combat the shin splint injury, okay? But first and foremost, when we have a shin splint injury, we've done something too much, too soon, too fast, okay? And basically what that means is we've probably implemented a training strategy that's not ready for us yet, or our body's not ready to accept that load. When we get muscle pain, muscles that attach to bones that are starting to create some pain and discomfort, it was a training error. So we've either started something too fast, we've jumped a distance too fast, or we're doing too much of it, okay? Or we're on our feet for too long a period of time. So one of the most idiotic responses I've had from the medical community when someone says, ask them how to treat shin splints. And the only way you can treat a shin splint is with rest. Well, that is incorrect. And for the running population, a lot of the people that I treat, that's not an option. Resting or sitting or doing nothing is not an option. So you need to understand that there are treatment strategies to this. You just have to go into it easy. Yes, you're gonna back your miles down. Yes, you're gonna back the amount of time on your feet and standing. You're gonna take all that back down and get back on track. And then as you're gonna start building back up from that baseline as you start getting some strength into the foot and ankle, around the knee and hip joint, and then you'll be ready to go, okay? So we're gonna go ahead and get started into the shin splints. Okay, everybody, we're in the clinic here with Madison, doing a little bit of shin splint discussion, okay? So here's knee, foot and ankle, and that bone right here running up the side of the leg is the shin bone, okay? So just like I talked about, there's two different types of shin splints, right? This is called the posterior tibialis syndrome, and this is anterior tibialis syndrome, okay? Through the lateral side, okay? So what happens on posterior tibialis, it runs on this medial border of our shin right here, and that tendon runs behind the ankle and then to the bottom of the foot. And what it actually controls is it controls your pronation, right? It controls your foot dropping in as you're landing, right? Your heel hits, foot comes down, you pronate, and then you toe off. Okay, so we're talking about the posterior tibialis syndrome, okay? Remember, it's on the inside of the leg, and that tendon runs underneath your foot right here, and it helps to control pronation of the foot. So as we're pronating in our foot, we're absorbing the force or the shock of the ground. So we're hitting the ground, we're rolling to the inside, and then pushing off. So the muscle that lines the inside part of our shin right here and comes underneath our foot helps to control for that. So when people are complaining of pain in this diffuse area right here, there's a couple different treatment options that we're going for, and I'm gonna show you guys the first one from a clinical side. I can help to alleviate some of the symptoms with some tape. It's called the kinesio tape, right? Or rock tape or rehabilitation tape, something of that nature. So what we do with the tape is we use the tape to help assist the posterior tibialis tendon to reduce the tension that's going to be placed on it. It doesn't mean you can go and run your normal distances, because just like we established, you've already done too much too soon, and it's not, you've overdone it. So we have to rest or provide some sort of relief to this guy right here. And then once we do that, the pain and symptoms will reduce, and then you can start to build again on the type of training that you'd like to do. You can't really jump rope at this point. You can't really do plyometric jump training at this point. There's a couple of strength rehabilitation things that we can do, but we're actually trying to work on some different things. Calming this system down. We can put a couple other assisted device in shoes to help out with that, and I'll show you guys that as well. So I'll show you guys the taping procedure on the inside part of the foot. Okay, everybody, so we just kind of demonstrated the taping application for the foot, and all it does is just reinforces the posterior tib tendon. It's almost like we're just giving it a little bit of support, right? We're giving it just a little bit of control so that it's not completely dependent on itself as it's running under. Like I said, that tendon wraps underneath our foot and helps to control, kind of check some of that pronation that we're doing in there, okay? So we're just adding a new layer of posterior tibialis tendon. Now, and then I put a tape on the shin, and that just helps to kind of keep everything towards the shin, kind of an athletic training principle to kind of tape towards the bone where the muscle's giving it a pull, okay? So the next thing that I could do for runners, and this is something that I really want to emphasize, is orthotic prescription or orthotic use. Orthotics are not intended to be used for the rest of your life. That's a misnomer. Because you put them in your shoe or you're tested for them, and we could talk all day about some of the methods by which the medical community prescribes orthotics. However, when we're going to put an orthotic in, especially someone who likes to do a lot of the running, when you slip in an orthotic, you want to do it for a period of time, and you're probably going to need to take it away, okay? So for someone who's really used to being out there and moving their foot, and maybe they've just done something too much too soon, but they want to still maintain some miles and hike and move around, we can go ahead and use an orthotic, and I'll show you what I mean, okay? So these are, I run in ultras. I tend to use the Torins, and we can have debates about those if you'd like. But what I have here, this is what I call a form thotic. I put this in this shoe specifically because I had worn out my insert that came with it from some of my running patterns that I'm trying to correct for, and based on my insert, looks like I'm getting a little bit better with what I'm doing with my runs. But as you can tell, this is the inside part of it right here, and it has a little bit of arch support. Not a lot, but it has enough. And these are very, very foamy and very, very comfortable. I like the full length. There's not a lot going on up front here. A little bit of a heel lift and control at the heel here. And I have dual form ones where there's almost two of these and it's a lot higher, but sometimes it's a little too much, right? So what I do with these are, I'll slip them in and let you run in them for a while. And so what I'm gonna do is I'm gonna pull these out after probably a couple of weeks in my shoes, as I've corrected some of my running onto the side or the blade of my foot. I'm trying to push myself in a little bit more. So this will help me prevent from rolling too far into that pronation. So as I use this, it's gonna help to stabilize or support that posterior tibialis tendon that we talked about on the inside part of the shin, okay? So as we're using these, like I said, this isn't lifetime prescription. It's for the period of time that you need it while you're doing your training, while you're running the long distances, while you're doing all this stuff, okay? So this is what I would do for a shoe, an ultra, fits in an ultra, fits in a Hoka, fits in all the different types of shoes, okay? So this is an alternative method to the treatment of posterior tibialis syndrome. And don't get me wrong, you can go ahead and pull these off the shelf at Walmart or a running store. I don't mind that, but just knowing why you're using it and how long you're going to use it for definitely helps. And you want to make sure you're trying to do that, okay? All right, everybody, we're going to talk about exercises for posterior tibialis syndrome or pain or shin splints, okay? So here's an example of that external brace applied to the shin to help reduce some of the posterior tibialis tendon discomfort. The orthotic was demonstrated, and so now this is the more intrinsic, like let's attack the muscle just a little bit, okay? And in times we don't want to do create another overuse with it, so we want to kind of create some strengthening. And strengthening protocols are typically you want to do sets of 10, 8 to 10, not more than 12, 3 sets or so, okay? If this is super easy, we don't want to do sets of 50 or 30. We don't want to do excessive amounts of what we call inversion of our foot. So inversion, like it means, is we're going in, toe is going in, okay? So this is a very, very light band that we're going to use just for demonstration purposes. If this is too easy, you got to go up on resistance. So band has to go around to the inside of the foot like this, and I'm going to stretch it out as much as I can, and I'm going to have Madison's going to pull her foot to the inside, okay? So right around kind of where the first part of the toe is, I'm going to pull, and she's going to pull in. There's 1, in, 2. We'll fix the band, make sure it doesn't roll down. Okay, pull, 3, keep going, 4, 5, 6, 7, 8, 9, 10, okay? And then what we want to make sure you're being careful of is you're pulling in, don't snap it back, right? In and control out, in and control out, in and control out, okay? So nice and easy, 3 sets of about 10 to 12 will help inside that area there, and you'll be good to go. So the first demonstration is the heel raise exercise, and it's demonstrated on a flat surface, but you can also do this on a step or a stair, and you're going to perform 3 sets of 15 repetitions. The next exercise is a modification. You're going to use a tennis ball or lacrosse ball in between your heels as you're performing the heel raises. And this specifically targets the posterior tibialis muscle. We have 2 stretches that we're going to talk about, and the first is a calf stretch. This is a basic runner stretch with the back leg being stretched. The body's just leaning forward on the back leg being straight and the heel staying on the ground. The next one is a modification, and it's for the muscle that lies just underneath the calf, underneath the gastroc muscle. It's called the soleus stretch. And this one is a modification where the back leg doesn't stay straight. You bend it forward like you're trying to lean, bend your knee down towards the ground. Well, thanks, you guys. Appreciate you joining us for this video. If you like it, please subscribe and hit that notification bell.